You're watching the KUSI Morning News.
And if you have a phobia that has been bothering you for years, we may have help for you. Details on a local company's virtual treatment that could ease those fears for years. If you suffer from high anxiety or have a phobia like fear of heights or fear of driving or fear of ants, you'll be happy to know there's a new way to face your fears head on. Sandra Moss joins us. You have a unique perspective on this, Sandra, I know.
I do. I know the Terminix's home, the guy's home phone number, Susan. I admit it, I have an irrational fear of ants. If I see one ant, I know there are more behind. And if there's a trail of them, I'm over the edge. Whatever your fear is, there is a new and interesting way to treat them. Technology and psychology have teamed up to cure your anxiety. And Mark Wiederhold, president of Virtual Reality Medical Center, is here to show us how. Welcome.
Good morning. Thank you.
A lot of people have a lot of fears, and they can be just really life-altering and affect your livelihood, affect your health, affect your quality of life. Give me a laundry list, if you would, of some of the fears that you're able to treat through virtual reality.
The most common fear we treat is fear of flying, and that's followed by fear of driving. Usually secondary to an automobile accident, people have post-traumatic stress disorder. And then the third is fear of public speaking.
Fear of public speaking,
yes.
And that can affect your livelihood. It's also being used in the military, you say.
Yes, we have a program now at the Balboa Medical Center to treat PTSD in veterans returning from Iraq and Afghanistan.
Post-traumatic stress disorder.
Yes.
Let's talk about how it works. You've brought this helmet with you.
Yes.
And then we're looking at some video of people in action, some of our war heroes in action. Tell us what we're seeing here.
These are actually fMRI images that are looking at brain activation, which some people are looking at brain activation while in the virtual environments to see what part of the brain becomes aroused during stressful situations.
So before you go into this program, and it is here in San Diego,
yes.
You're evaluated by a psychologist who tries to figure out exactly what it is that is triggering your stress.
That's correct.
And so then you put on the helmet, we see here on the right side of the screen, and what are they looking at?
Now this is for treating fear of flying. This is the virtual airplane. And you actually, when you come to the clinic, you sit in these airline seats, you put on your seat belt, and then you use the head mount to see the inside of the plane. You can actually look around the inside of the plane, you can look out the window, you can see takeoffs and landings. Now this is for treating fear of heights. In this case, you're going in an elevator, which exposes you to various levels of heights.
And so by watching this, your fear, through virtual reality, it's a bit of a comfort zone, isn't it?
It is. A lot of people come in for this therapy. It's a nice middle ground. The two choices are either using your imagination in the therapist's office, which works fine for a lot of people,
right.
Or actually, for example, if you're afraid of flying, to get on a real plane. And again, some people can do that, but a lot of people would rather use this as a middle ground. It's much more comfortable for folks.
We talked about, we're seeing the fear of heights there. A lot of people are afraid of bugs, spiders, ants, snakes, whatever. What is this that we're seeing?
Now this is using actually a video game that we modified to treat fear of spiders. And so in this case, you would be gradually exposed to spiders. We'd start with a very small spider that wouldn't move around too much like this one. Then we gradually make the spider larger and larger. We might add many more spiders, so eventually you'd be comfortable walking into a room with maybe 20 or 30 giant spiders.
Now, how many times do you have to go through a treatment like this, and it lasts about an hour, before you're cured of your phobia?
It's usually 8 to 10 sessions. Some people take a few more.
And you've done clinical trials on this. This is not a bunch of hooey. There is some scientific backing.
We're also funded by the National Institutes of Health to do some research programs.
Tell us about where you can get this treatment in San Diego. You've had clinical trials, and you do offer it here in town.
We do. It's at the Virtual Reality Medical Center in Sorrento Mesa.
And what about your cure rate? How many people who actually go through maybe a half dozen of these treatments resolve their fear?
We've had a 92% success rate overall, so it doesn't work for everyone.
92% isn't bad, though.
It's not bad.
All right. Well, you know what? I think I might be coming in to deal with my ant phobia. I'll be putting on the helmet and trying to work on this problem, because everybody who knows me knows I've got a big problem. Thank you for being here.
Thank you.
I've got to work on my issues. Dave, Susan?
I love it. All right. And that is a great look on you, too.
Oh, you think so?
Great look.
My helmet
All
here.
right. Thank you so much.